Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
According to the National Alliance on Mental Illness, also known as NAMI, 1 in 5 adults in the U.S. will experience a mental health condition in their lifetime. Well, you say, what's a mental health condition? Well, it's a disorder. Well, it's a disorder or an ailment that affects your mood, your thinking, or your behavior. Now, examples of mental health conditions include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors.
Each May, NAMI and participants across the country raise awareness for mental health in an effort to fight stigma, provide support, and educate the public. Here to discuss Mental Health Month is Mayo Clinic psychologist Dr. Craig Sawchuk. Welcome back to the program, Dr. Sawchuk. Good to see you.
Great. Thank you for having me back.
Thanks for being here, Dr. Sawchuk. I suspected that it is probably an understatement to say that mental illness is a big problem in the U.S.?
Without question, and as we've discussed in previous segments, is that seemingly whenever we do a new epidemiologic study, we see those rates of mental illness actually increasing as time goes along.
And is there an explanation for that?
I think, there's multiple things in our life that are very stressful, and the pressures continue to increase, so we're experiencing new and different stressors all the time. So I think that's what's going along to increasing rates.
It seems to me, though, that if you're asking people, that they're saying, yes, I do have a mental illness. And so then that would explain why. Because before, people weren't being asked.
Yeah, and that's actually a good problem to have, actually. And one of the ways that we've been doing that is assessing it more in primary care, but there's also been some better public service announcements. There's a better alignment of looking at mental illness and mental health as just health in general. So much more frequently now you're seeing that asked in a wide variety of different environments.
Well, what do you think about cell phones? Do they have anything to do with the anxiety and stress in our lives? It seems that, 20 years ago, we didn't need a cell phone. Now, everybody's using it while they're driving. I mean, and who's next? And who's going to call me? And what did they say? And what's on Facebook?
So you're going to pin this on cell phones?
I am.
Well, it definitely has been one of those technological advances where, to some degree, we're always on. So I think you're exactly right. It's just another evolution of how technology can be helpful by increasing our availability and accessibility, but it also increases the raw frequency of the types of stressors that we're exposed to.
Well, I don't know about your kids, but it seems like people don't know when to turn it off.
But there was mental health issues. People had mental health concerns before all that technology came along.
Not this bad.
Yeah. Well, you make also a good point about not knowing when to turn it off, because sometimes sleep disruption that can be a very common problem with electronic use in general and cell phones in particular. That can lead to sleep disruption, which can actually not only increase vulnerability for mental health problems, but it can exacerbate existing mental health problems as well.
How about the most common types, the things that you see in your office almost every day? What types of mental illness do you see?
Yeah, far and away, the big two are anxiety disorders and depressive disorders.
And are those opposites?
No. I mean, there's probably a lot more overlap than they are different, but there are some unique differences. So we think of like what happens with anxiety. It's almost like an upregulating type of state. So you see a lot more physiologic activation, like increase in heart rate, muscle tension, blood pressure, racing thoughts as well too, and worries and that urges to avoid. And then you think of depression almost like a down-regulating type of emotion. So we get sluggish, we get really slow, it's really hard to motivate ourselves. We may not necessarily avoid because of fear, but withdraw because like the why bother thinking leads to why bother behavior. The challenging thing, when we look at those rates of mental illness in the United States, we also have to keep in mind that there's a lot of comorbidity that goes along with mental health conditions. So we take the top two, anxiety and depression, they're comorbid about 60% of the time. So
what do you mean by that?
So they're likely to co-occur together. So the two conditions usually show up at the same time, or say anxiety, and that's one of the probably the most frequent condition that I see. People can be struggling with anxiety for a while, and almost like the erosion or the wear and tear of struggling with anxiety and some of the impairments that it creates in a person's life can lead to feelings of depression.
I have a question. Here's what doesn't make any sense to me, and I know there's a lot of things that we don't understand about mental illness, but some of the medications that are used, that you use, treat both anxiety and depression, and to me, they're sort of opposites. I've never understood that.
Yeah, sometimes it's all in the name of a particular medication. So we think of what you're referring to are a class of antidepressant medications. So we'll take, the most common being Prozac, for example. It's an antidepressant, but works very well for not only treating depression, but many anxiety disorders as well, too, because the serotonin system gets dysregulated. Now, we think of anti-anxiety medications. They work in a different way with the body, and they work more on the peripheral nervous system. So they kind of settle the body down, but they actually have a depressant effect. So you always have to be careful about benzodiazepines like Valium or Xanax and those kinds of medications when somebody is depressed, because it can actually slow them down or depress them further.
Can you prevent mental illness from happening? I mean, can you will it? Can you will mental illness away?
Well, I think we've got a career in trying to figure that out, but not entirely, because there are lots of different ways that mental illness can come about. So if we think of almost like a tripod of risk, so one is we have to be cognizant of biologic factors. So within that, we think of familial genetics, basic temperamental style, and sometimes certain health conditions or even medications that are used to treat. Other conditions can cause or exacerbate existing mental health problems. So there are certain mental health conditions that genetically have a stronger load, like OCD, social anxiety, schizophrenia, bipolar disorder. Then we think of the second leg of the tripod being the environment, and this happens in context, and this gets to Dr. Shai's comment a little bit earlier on, is that the environment around us can be more stressful when we're exposed to more unpredictable, uncontrollable stressors. That increases our overall stress load. And finally, the third leg of the tripod are just learned factors. So how have we learned to cope, control, kind of deal with stress over time? So it really, kind of depends. We have to look at all three of those factors to see how much movement can a person make in terms of managing their mental illness. And there are some, mental illness, mental health conditions that folks struggle with that they actually do very, very well with medication or behavioral therapy alone or in combination. And other folks, they're going to be having to deal with this to a greater or lesser extent over time. But we can always do treatments that can help make things less bad.
Is behavioral modification or talk therapy, is that a key component of this? It seems that whether it's anxiety or depression, a lot of people just want to manage it with medication only, end of story.
Yep.
But it would seem that you're missing part of the solution.
Very much so. So in my world, we really look at skills and pills that are in there. But you bring up a great point, Tracy, that I think just the way that the medical system has been built, and culturally it's easier to prescribe a pill than it is to learn a skill. The downside of medications is sometimes you have to deal with the side effects as well too, and it may not be quite as effective over time. Whereas a skill, it's a lot harder work. That's the downside, but the durability of effects over time. From our research is that when we're treating anxiety disorders, behavioral therapy actually tends to be more effective than medication management, whereas depression, especially more severe cases of depression, medication management tends to outperform behavioral therapy. But in certain cases, definitely the combination of the two, you are more likely to see some positive outcomes with that.
It does seem that people are more willing these days to say that I have a mental health issue, but they are not willing to go as far as, and here's what I'm doing about it. There's a medication seem to be getting so they're perfect that they're helping people, and then they don't have to go and do the skills part.
Right. Yeah, we always think, I think it's like this with any healthcare intervention. We're always trying to look for minimum sufficiency intervention, so it's the least amount that we can do to help somebody out. But we also want to make sure that, therapy or treatment is like a choice. So if we can provide folks with options, so options could be medication management, behavioral therapy. We've talked about mental health apps in the past as well, or even wellness types of interventions like exercise and sleep management. If you can give people a limited range of effective treatment options, they're much more willing to engage rather than saying this is the only treatment for you, or this is the one I feel comfortable in delivering, so this is what you're going to get.
All right, our guest is Dr. Craig Sawchuk, a psychologist at the Mayo Clinic. And remember, May is Mental Health Month. Time for a short break. When we come back, we'll talk more with Dr. Sawchuk, plus this myth or matter of fact.
Yes, myth or matter of fact, 60% of adults and 50% of children with a mental illness didn't receive mental health services last year. Is that a myth or is that a fact?
I hope it's not a fact, but it might be. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
May is Mental Health Month, and our guest is psychologist Dr. Craig Sawchuk. We're going to talk about treatment of mental health illness with Dr. Sawchuk after this myth or matter of fact.
60% of adults and 50% of children with mental illness didn't receive mental health services last year. Is that a myth or a fact?
Unfortunately, that's a fact.
Wow.
Yeah.
Now, why is it that so many people don't get help?
Well, I think, we still have some ways to go with dealing with the stigma of mental health related issues. And we see this will vary in cultures too, in terms of how willing are people to express struggles. One of the other issues that's also really important are social determinants of health. So sometimes it's just because of poverty, lack of access to care. There's lots of other things that get in the way of being able to access any kind of treatment, let alone mental health treatment. So we've definitely been doing better overall with making treatments more available, but there's still quite a long ways to go.
Are there enough of people like you, psychologists and psychiatrists, to handle the mental illnesses out there?
Well, it depends on who you ask. Some people feel that there's already one of me, and that's more than enough. So it really depends.
That's just your kids and your wife.
Exactly, exactly. It really, there's never going to be enough healthcare providers or mental health care providers for everybody, and that's also not the way of doing treatments. I think that what we've been able to do over time, especially with our health services related research, is really moving treatments out to where people access them. So here in the United States, really moving it into the primary care service, because that's actually where mental health conditions present much earlier than they do in especially mental health settings. Out in the UK, they've really retooled completely the National Health Service, and they've dramatically expanded the accessibility and availability of mental health services in community centers, in towns, so even like in non-medical settings as well too, that have really helped to really revolutionize their system.
With the help of the royal family. William and Harry and Kate have all jumped on board in helping with that.
Exactly. And this really kind of gets back to that point that there's been a tremendous evolution in reducing the stigma. And it really, really helps when folks that are in a position of power and influence and on the media that can increase awareness not only of these problems, but even more importantly, how to access care and what is good evidence-based care.
Let's talk about the levels. Oh, sorry.
I just ask one follow-up question. Did I hear you imply or say that much of the mental illness in this country can be handled by primary care physicians, family physicians?
I think that they can be they're the first line. I think that there's, again, lots of other ways that we need to work on improving mental health management and treatment. There's been lots of developments in population-based health programs. So this is just ways that we can improve screening for mental health conditions within primary care, having treatment algorithms for evidence-based treatments for medication management, and then also having behavioral health providers, psychologists, and social workers right at the point of care that can also team with a primary care team to help manage mental health conditions where they show up.
So
Very good to hear.
If you start with the primary care doctors, I would imagine that would be the first level of treatment. You said levels of treatment is something that we should discuss.
Right. So we can almost think of levels of treatment almost like intensities or different step levels of treatment. So this is, the whole idea of providing options for patients, but then also trying to gauge your treatment to the intensity of the condition that you're seeing. So at one level, we can think of it of a low intensity level. So we can think of this more like wellness types of interventions like exercise, sleep regulation, diet, building social support, traditional self-help materials, or even mental health applications. So those we would consider low intensity because they don't involve much work on a provider part. That's where we think of a moderate level of intensity, and that's where engagement either with a primary care team or a mental health provider, typically on an outpatient basis, of more structured treatment program with specific goals in place. Then we think of a high intensity type of treatment, which could be more of an inpatient side of treatment. So we can think of more emergent services, inpatient psychiatric hospitalizations, addictions programs, or even comprehensive outpatient treatment specialty programs. And there's plenty of specialty higher intensity outpatient programs for anxiety, depression, and substance-related disorders.
Do you have a pretty high success rate? I mean, are there a certain percentage of patients that have a mental illness that can't be helped? Or would you say that pretty much everybody who comes in for help gets help and gets better?
Well, we'd like to believe that. There's so many different factors that go into treatment, but then also the factors that are outside of treatment that may have contributed to the mental health problem in the first place still remain, over the course of time. We're still working towards trying to increase the number of people that are actually receiving care. Within that, not everybody receives evidence-based care. So we think of from a psychotherapy standpoint, there's lots of providers doing psychotherapy out there. Unfortunately, not all of them are evidence-based.
And tell us what that means, evidence-based.
Yeah, evidence-based is based upon, well, what does the research literature show in terms of what
do
types
we know works?
Exactly. And in previous shows, we've talked about the role of exposure therapy being such an important treatment principle from a behavioral standpoint for anxiety, but we can also think about it from a medication management standpoint. So, for example, somebody may be on an antidepressant for a major depressive episode, but maybe that medication isn't dosed high enough to have an effect on them. So they're actually being underdosed, or maybe that's the wrong medication for them. So there's lots of additional factors that really do play into improving their mental health condition.
We have about 30 seconds left. Can you tell me, how do we break down the stigma of mental illness? That's what Mental Health Awareness Month is all about.
Yeah. Well, dedicating a month to this is a great step in that direction. And I really underscore what Dr. Shives mentioned right out of the gate, the National Alliance of on Mental Illness. They do a phenomenal job across the country in so many different communities. So I strongly encourage people to go to their website, which is www.nami.org. It's a great website that provides not only great education, but then also in resources in the community, and many of which are free, for support. And there are other national organizations like the Anxiety and Depression Disorders Association of America, and the advancement of behavioral and cognitive therapies, also great organizations.
Well, thanks for all of your help. Thanks for being here. It is Mental Health Month this May, and we've been talking mental health awareness with psychologist Dr. Craig Sawchuk of the Mayo Clinic. Thanks, Craig.
Great. Thank you.